Hello, my name is Jerica Marshall, and the following is a presentation of the strategic plan for the organization University Health. Strategic planning involves leaders identifying the direction of the organization and making decisions accordingly to generate success. A tool utilized in strategic planning is a SWOT analysis. This analysis identifies an organization's strengths, weaknesses, opportunities, as well as threats. When a SWOT analysis was conducted on University Health, the weaknesses identified involved patient satisfaction as well as financial needs. Hospitals are now competing in quality versus in price. So the strategic planning focus is on the patient. Patients are being responsible for higher portions of their health care cost. So based on that analysis, the strategic goal is to maximize profitability by providing quality, cost-effective care. Another tool utilized in strategic planning is a strategy map. The strategy map is a visual summary of the intended strategies or plans to improve the organization. So our focus is on patient satisfaction. So how do we improve it? Well, patients have been complaining about not getting their pain medication in a timely fashion. They've complained about, injury such as falls, and they've complained about long waits in utilizing their call light. So the proposed change to accommodate or combat those complaints is to initiate hourly rounding. So the departments involved would be the technology department as well as the nursing department. The technology department is involved because of the Epic charting system. A flow sheet would need to be created in order to allow for documentation from the nurses and the nursing assistants. So the plan is for nurses to document and round on odd numbers, and then the nursing assistants would then round and document on the even numbers. For the hourly rounding, the patients would be assessed for their needs. Do they need anything such as pain medication? Do they need any ice? Do they need to go to the bathroom? And the patient's safety would also be assessed as far as is the bed in the lowest position, or is the call light within reach, and is the bed, of course, locked. And prior to leaving the room, the nurses and the nursing assistants need to double check with the patient just to make sure that all needs are met at that time. Communication is key. So the nursing leaders will meet with the technology department leaders or the Epic leaders to discuss the flow sheet. The flow sheet for hourly rounding would need to be created prior to introducing the idea to the nursing staff. So once that flow sheet is created, the nursing leaders would send an email to the nursing staff introducing that idea to them. The email would include the requirement for documentation as well as the intended date to implement the hourly rounding. Following that email, there would also be a staff meeting where employees can ask questions and gain clarity if needed for the hourly rounding. So how do we know that the hourly rounding has been effective? We can look at our fall scores. If the fall occurrences have decreased since hourly rounding has been implemented, we can also say that hourly rounding has been effective. Also, with patient surveys, the callback team generally calls the patient a few days after they've been discharged and asks them questions about their stay. If the patients are saying they've been satisfied with their care and they would recommend the hospital, then we can also say that the hourly rounding has been effective. In conclusion, hourly rounding on the patients in assessing their needs creates a safer environment for the patient. Hourly rounding also allows the patient to receive their pain medication in a timelier manner, and allows them to get all their needs met sooner than having to wait for the call out or wait for the nurse or the nursing assistant to eventually round on the patient. By increasing the rounding, it also would increase patient satisfaction. If patients are satisfied with their care, that would also increase chances of achieving our goal, which is to maximize profitability by providing quality, cost-effective care. Thank you.